Hi, I'm Dr. Nathan Tanner with the Airway Center, and we have the case of an 8-year-old boy. His central incisors are in. There is no space for his lateral. He has about 1 millimeter of space, maybe 1.5 or 2 millimeters on the right side. So he's headed toward major crowding. We can see on the lower, his front 2 permanent lower incisors are in, and there's a lot of overlapping even with those. So his lateral incisors are going to be definitely majorly crowded. He probably has some airway and sleep issues going on. His lower jaw is very recessed back. Getting his upper jaw up and forward, lower jaw forward, a little bit of a forward head posture is really going to help. But right now, sometimes these lateral incisors will push out the primary canine, and that can happen on the top or bottom because there's so much crowding. The teeth are definitely crowded up in the bone. And here we see his canine almost right behind his premolar. So his permanent canine has been pushed back by his lateral incisor, which is squeezed in there. So his centrals are in, his lateral incisor is kind of stuck down in there on both sides. And the permanent canine is right over the top of the permanent premolar up in the bone. This canine is starting to kind of go at the wrong angle. His upper second molars are kind of pointing backwards on both of these. His lower second molars are coming in at the angle of the mandible where this rotates up. So he desperately needs his upper jaw developed in a forward direction. He needs his lower jaw to be able to develop and grow more forward. On his parents' questionnaire, he has mouth breathing, drooling on the pillow, tossing and turning, nightmares, difficulty falling asleep, groggy, moody, anxiety, fidgety legs, chewing with his mouth open because he's got to breathe even when he eats. So all these sleep issues we expect to benefit going through treatment, having his airway opened. Mild sleep apnea, twice an hour, every hour he's in respiratory distress or respiratory disturbance. One of those lasts anywhere from 11 seconds to 31 seconds, heart racing up to 108 beats a minute. So his sleep, definitely quite a bit of fragmentation here, and cardiovascular heart rate stress is definitely there as well. So a lot of tossing and turning, a lot of disrupted sleep patterns, a lot of arousals all night long. So he really is going to improve a lot. His intermolar width is 29, which is very narrow. And getting him widened as well as forward would be a really big benefit. I see a big wear pattern on those canines. His first molars are kind of, coming in with tissue over the top. Almost looks like the angle of the mandible kind of coming up. So really getting these forward will help these molars be more in line with the jaw for eating and chewing. He has mouth breathing, mentalis strain, no enlarged tonsils, wear on the teeth, narrow palate, high palate. So his tongue, he definitely has some restricted tongue, so maybe like a grade 3 there. And his indicator line at age 8 would ideally be 31, and it's a 39, 8 over, which is very high. So a lot of excess downward growth instead of forward growth. We want to get his jaws growing forward.